The purpose of the Global CFO Council is to provide an educational and networking forum for senior financial executives in order to share best practices, discuss current financial issues, and to learn about current topics related to the performance of their jobs.
Good morning, everybody. Let's get started. I am super excited about this presentation and super excited to have Warren and Vince with McGriff Insurance to present it. Warren and Vince are longtime supporters of the CFO Council and just awesome people. And looking forward to this presentation. As always, stay muted. If you've got any questions, we'd love to have them. Put them in the chat box and I'll pull them out. A couple of times during the presentation, we'll stop for questions and I'll pull them out and ask the presenters. The CFO Council, we're global now. We've got 1,000 members in 11 countries. Started off in the Carolinas, but we've been expanding. And wherever there are 100 or more gathered, we have physical breakfast meetings every month. We're also virtual during COVID times and have these monthly meetings like we're doing right now. And our charity partner is the Educational Foundation for Women in Accounting, the EFWA. And they give scholarships to women pursuing undergraduate, graduate, and PhDs in accounting. And the scholarship period is open right now. So if you are a woman or know a woman who's pursuing a degree in accounting, then check out EFWA.org and see their scholarships. And thank you to some folks on this call right now who are serving on the scholarship committee or serving as a mentor to scholarship winners. And like I said, Q&A in the chat box, stay muted, and let's get this party started. Warren is the Senior Vice President at McGriff, and he is not a job hopper. 28 years at McGriff. Only job the guy's ever had. One job, and amazingly, has never had an employee in his entire career. That is the dream. He is living the dream. Undergraduate degree in business management from Presbyterian. I love Presbyterian College because they are in the same football conference as my alma mater, the Kennesaw State University. And Kennesaw State University plays Presbyterian every year. And we have collectively beat Presbyterian by a spread of 139 points to 10 over the past 3 years. Warren played soccer at Presbyterian College many moons ago, and wife, 2 kids, and is a member of both the Charleston and the Upstate CFO Council because he is awesome. And Vince, not to be outdone, is the Employee Benefits Advisor at McGriff. He is a super volunteer in the Upstate. He and Carly are always there making the meetings happen. He had his undergraduate degree in marketing from Liberty, and an MBA from Robert Morris University. Not only is he a super volunteer with the CFO Council, he's also a super volunteer with the Children's Museum of the Upstate, married, 4 kids, and he played a little bit of football when he was in high school. He's a 2-time All-State high school football player, also has the bench record, and questionable taste in music, piano jazz, if his MySpace page from 1964 is accurate. Welcome both Vince and Warren today.
Thanks, Robert. We are very excited to be here. Just a quick bit of information about McGriff in case you're not familiar. As most of you know, BB&T and SunTrust merged a couple of years ago and created the 6th largest bank in America, Truist Financial. McGriff is the insurance arm of Truist Financial. So we're one of the top 5 brokers in the U.S. and top 10 in the world. And we're happy to help if you have any questions. And thinking about 2020 and looking forward to 2021, Martin Luther King Jr., I love this quote, "I have no despair about the future." So we can all be positive and charge into 2021. And definitely looking forward to seeing what this year has to offer. In looking at employee benefits, because things tend to move slower than maybe other industries. This is really insurance trends for, we'll call it 2021 to 2024. And so we always look 1 to 3 years and see where the industry is going. Obviously, with the presidential election, there are going to be some vast differences in agendas. And so really, Trump's main focus was dismantling the ACA, and Biden is going to look to strengthen and bolster the ACA, and he's already taken steps to do so. A big area we're going to see this happen in is expanding subsidies. So there's even talk now about, and relates directly to employer-sponsored plans, there's talk now of offering working class poor the ability to go to the exchange and receive a subsidy, even if they're offered an employer plan. And so, you know, when you look at somebody who only makes, we'll call it $25,000 a year, employer might pay 80% of their premium, but then they're on the hook for this huge amount for their family. And so now that they might have the ability to go get subsidies in the health insurance marketplace, that might present a more affordable opportunity for them, but it also presents maybe participation issues for certain groups. So we definitely want to stay on top of that. There's also talk of lowering the Medicare age to 60. If this happens, then it could be a good thing for employer plans. It could also mean that people are retiring early as they can take their contributions from IRAs and the distributions from IRAs and those sorts of things. Because a lot of times people will hang around from 60 to 65 because they don't want to pay the $1,500 individual health insurance premium on the exchange, and they don't qualify for a subsidy. So those are some of the things that are going to be different with this administration versus the previous. But there's actually a lot of bipartisan support around the same measures. Trump had started really looking into price transparency with hospitals and the networks and what they're actually charging. The same is true for the pharmaceutical industry. And there's actually bipartisan support for that. So I'm not sure the Democratic support for it will go as far as what Trump was looking to do with the most favored nation status and those sorts of things. But that's a main area as far as price transparency having bipartisan support. The other aspects are value-based care, which we'll talk more about in a minute. That really rolled out last year, and Medicare saw significant savings, and it's starting to flow into the employer space. And then the last round of stimulus, the relief from COVID, they also had a measure in there regarding the elimination of surprise billing. So, you know, if somebody goes to the hospital and there's hospitals in network, but they go see an out-of-network provider, and then they get all these surprise bills, they want to do away with that. So that's been passed. So the regulatory agencies have until, I think it's the first quarter of 2022 to issue regs on that. Okay. So how did COVID affect claims, and what does that look like for trend? Some of you have just finished your renewals, so you might not care too much about this. And by the way, I love this slide. My mom cut my hair all the way up until I went to college, so I appreciate the styles in this picture. So how did COVID impact claims? Well, when you look at the high cost claims, which are really driving the health plan in a lot of ways, it really didn't have much of an impact in that area. Where we saw most of the claims impact was on those lower level claims. People did not go get immunizations or mammograms or just different, more routine care that typically isn't the big cost drivers in a healthcare plan. So your experience might have been different. Most of the trend that we're seeing is around the 8% to 9%. And that plays out in different ways. There's different reasons for that if you're fully insured versus self-funded. But that's typically where we're seeing. So it wasn't this huge claims impact that we thought we were going to see back in March. Okay. So big trend that you need to be aware of is the pharmaceutical industry issuing more and more specialty drugs. These are the high dollar drugs, $50,000 to $500,000 a year, but they can easily exceed $1 million. It's not uncommon, and so we typically see that in the gene therapy area with cancer, with different kidney diseases, spinal issues, those sorts of things. And so I'm just going to read this top box just to make sure that, just to reinforce the point. In 2008, the average cost per specialty claim was $1,600, and there were 249 new specialty drugs approved by the FDA and launched in the marketplace. So you can see the increase, and fast forward to 2020, $6,300 as an average cost. This is cost per claim, not annual cost. So the typical annual cost is more in the $200,000 range. So 700 new drugs were issued last year in the specialty market. So there's definitely more and more. The pharmaceutical companies know where the high growth opportunities are, and they're in these diseases and conditions that affect a small part of the population, but they're very medically necessary. The specialty growth, as far as the percent of new drugs to the market that are specialty drugs, in 2010 it was only 21%. And by last year, it was 62%. And this year, they're projecting 73%. So for your employer-sponsored plan, you definitely want to know what your pharmacy contract looks like. Do they have step therapy? Do they require prior authorizations? And a big one, it sounds silly, but is the drug medically necessary? And one of our specialty pharmacy benefit managers, they're a specialty carve-out vendor. The president of the company relayed to me, there's just a bunch of pharmacists and medical professionals, and so she relayed to me, they actually had a case where a prescription came through. It was Neutropin, which is a growth hormone, an injectable, and it was for 3 brothers, and basically they flagged it because it's about a $50,000 drug. And when they dug into the kids' medical records, they found out the 2 youngest boys were twins, and they were already in the 75th percentile for height. And then the oldest boy was in the 90th percentile for height. But this doctor was trying to push the prescription through. I don't know if they were looking to make athletes out of him or what, but basically what they found out, they turned the claim down. The doctor actually appealed it, even though it was not medically necessary. So it was turned down again, and later on they actually investigated that claim and found out that there were kickbacks from the pharmaceutical company. So that's an extreme situation, but if there's no flag or no parameter around that, that's $150,000 going to your claim. There could be a spec claim if you're self-funded. So it's definitely something you want to be aware of. Another big issue is the drug being filled at the hospital, or is there another way to dispense the specialty drug if it's like an injectable or an infusion? And so typically if it's done at a hospital, it's going to be exponentially higher than if it's a home health care or administered elsewhere. Okay, so if you're worried about that, some ways to mitigate risk: look at a captive if you're self-funded or have the ability to go self-funded. It's not for everybody, but if you're concerned about some of these, $1 million claim, there's been a 400% increase in $1 million claims in the last 5 years. So if you're concerned about that, a captive is a great way to do it. Always look at your PBM contracts, and if you're self-funded, you can look at carving out the specialty or making sure your pharmacy benefit manager has a strong specialty contract and language. Okay. So let's talk about virtual care integration. COVID definitely if there was one area in healthcare that COVID put a spotlight on, it was the need for virtual care. We saw telemedicine, just industry-wide, there was about 65% participation in like the teledocs, the call-a-docs. And after last year, it's up to 95%. So it's pretty much across the board now. And what we saw as an amplifier to the medical conditions is, if you look at the mental health aspect, record number of antidepressants and other stimulant drugs were prescribed. And so that's something, to know how your health plan covers that, but also to look at the mental health aspect and make sure we start looking beyond just the telehealth, which is important. 25% of all telemedicine visits are for RX refills. But when you start adding mental health issues to the mix, it is a huge amplifier to medical claims, okay? So just some statistics. If you have a medical condition and you add a mental health issue to it, you're gonna pay, it's gonna cost 2.5 to 3.5 times more than just a standalone medical issue. And if you have a chronic condition, such as diabetes or something along those lines, and you add a mental health issue to it, it's actually 12 times. That's from PricewaterhouseCoopers Health Institute, 12 times the cost. So it is imperative to really understand the mental health issues and make sure you're taking care of your employees. And I know sometimes that can be hard, like is somebody really depressed or are they having a bad day? But really having a set, it's starting with the EAP and maybe working up to a full-on integrated effort with a virtual care company like a Teladoc can be a great solution. So when Teladoc actually merged with Livongo, so everybody's familiar with Teladoc, they're the 800-pound gorilla in the virtual care doctor visits. Livongo is actually the 800-pound gorilla in the mental health disease management programs that are virtual. So you're going to see a whole robust solution offered through Teladoc in the near future. Okay. All right, expanded healthcare delivery models. I'm very excited about this because this is a absolute fantastic way to cut costs. We talked a little bit about value-based care, and the way you can think about value-based care is in the current situation that you don't really know what you're paying a lot of times, or it's a fee for service. So if I go to the doctor 27 times, there's more stuff they can bill me for based on the 70,000 codes that are in the J code little formulary list, and they can always look for more codes to bill to the health plan. And so there's a lot of opportunity for fraud. Again, not everybody's taking advantage of that, but it's definitely happening. And Medicare medical fraud is rampant in health plans. So value-based care basically takes procedures and says, okay, if you're having a knee surgery, our health plan is going to reimburse the hospital X amount of dollars. So we'll call it $35,000. Well, normally you would get the bill for the anesthesiologist and the physical therapy and the surgery and all of these things. And if there's an issue or a complication, then they can bill for that. And if there's an infection and you have to go back 2 days later, they can bill for that. And so this is putting the onus on the doctor to actually have a better outcome in order to be compensated fairly. So if there's an infection and somebody has to go back in to the provider, then that's on the doctor's office and it's not getting billed to the health plan. So another way to think of it is outcomes-based care, which sounds like common sense to most of us in the business world, but because of the way that healthcare has been set up, they just haven't had the necessary accountability in a lot of ways. And so this is bringing accountability to the doctors who are providing the care. I hope that makes sense. I know that can get kind of convoluted trying to explain it, but it really is a good thing. Right now, we're seeing it more in the very up market, like 1,000 plus, but I think in the next 1 to 3 years, it's going to come way down, even in the small group market. And I know Humana and Blue Cross have already tested this in other states in the small group plans. So hopefully it'll get here soon. All right, narrow networks. This is basically, again, we'll take knee and hip replacement as a condition. This is basically saying you have your whole health plan to choose from, but we're also going to provide this narrow network or steer you to these certain providers for knee and hip replacement or whatever the condition may be. And so we actually layered this in for a client in the fourth quarter. So now instead of just going to wherever their doctor sends them and having a knee replacement be $50,000, $60,000, they have a number to call for these conditions, and an RN will actually find the right place within a reasonable geographic space, and the cost is typically about 50% of what you would pay through a health plan, And because of that, and because it's self-funded, they're actually part of a captive, we can actually, the group is actually waiving the deductible for the employees, so it's a win-win. The group's paying half of what they would normally get charged, and the employee doesn't have to come out of pocket to $3,000 for deductible, and then the out of pocket after that. So it's funny that one of the big trends that we're seeing, and I didn't want to go into this because it's more in the healthcare space, is digital health is just, it's exploded. Last year, I think $80 billion in capital flowed into these digital health companies. So you're starting to see a lot more price transparency tools, and we talked about the virtual care integration. And so basically, we are seeing a lot more tactics being drawn into different health plans. And so it's important when you look at all these tactics, number one, what's the bandwidth of your HR department to really understand and educate your employees? And then number two, user adoption. How much of this are your employees going to retain? How do they know when they have a condition that they can go to someone outside of maybe the health plan through a narrow network, or if there's a smoking cessation program or a diabetes program, whatever it may be. And so if you look at these concierge services, they're kind of like the healthcare navigators. And so that can be a great way to cut through the clutter and just say, hey, if you're diagnosed with anything, give this company a call, and they'll be able to walk you through exactly what the health plan has to offer. Okay, and it's typically a win-win. There's some incentives built in, and then the employer plan saves money, especially, like I said, in a self-funded environment. Okay, there's so many tactics, and I'm going to wrap up with this. So many tactics. Okay. It's more important than ever to have a 3-year strategy put into place for your benefits. I'm showing this. This is one of the ways that we look at strategy. Looking at the 4 main quadrants: managing cost, risk mitigation. That's obviously CFOs and controllers. They're looking at the left-hand side there. How do we manage cost, and how do we manage risk? And then if you look on the other side, that's sort of typically the HR functions of operational excellence and enhanced member experience. And so we look at it from a big picture, but then if you look in the middle, it's very important. A lot of this hinges on your company culture. And so as you go through the strategy process, ask yourself, why do we even offer benefits? Are we more of a paternalistic type company, or is it just to check the box and we want to have best in class in other areas? So it's very important. Again, there's going to be more and more programs to offer. And it's going to be more important than ever to have a solid strategy in place. What's the goal of your health plan? Robert, any questions?
We have a bunch. And one thing I'm going to have to read just verbatim some of these questions because I don't even know what they mean. So I
might not either.
Yeah, I'm going to hit you rapid fire, okay? Because at some point we got to let Warren talk. So don't, if there's a short answer is cool. One was, what is a captive?
So a captive is, so in the self-funded environment, you have the claims that the employer pays, and I'm simplifying this, claims employer pays, and on top of that is the stop loss reinsurance, okay? That covers your high claims and your excess loss. So all a captive layer is, it lowers the amount that the employer's paying, it raises the amount of the stop loss coverage that the employer is getting out in the market, and it adds a captive layer of reinsurance, which is you join a captive, you are part owner in a captive, and it's actually like an additional layer of reinsurance. So that's the simplest way to put it. It's a way to mitigate risk. It is a pure financial play. It doesn't look any different to your employees from a benefits perspective. We always have that conversation with the CFO and controller. HR typically doesn't get into that, but they need to be aware of it.
Earlier in the presentation, you talked about the Biden administration. I can't remember if you covered it. During the election cycle, there was a lot of talk about Medicare for all. Any thoughts about the possibility of that?
Probably not going to happen. Hospitals took a big hit, and in Medicare last year, hospitals took a big hit, In Medicare, the reimbursements are lower to the hospitals, and so they're not looking to put an extra burden on the hospital. So there is, for most of the chatter and what I've read, there's not going to be a Medicare for all option.
How did we? You said that COVID caused a lot of other care to be reduced, and I've read that claims were down sort of on average. So why did all of our premiums go up?
I think the better question is, why is healthcare so expensive? Health insurance so expensive? It's the same issues. There's 5 or 6 big issues. That's a whole separate presentation. But you know, your claims go up based on you. I think there's a little hedging of bets by underwriters. You know, they're not willing to toss the dice and take risks. And I think there might be a concern on underwriters' parts that there will be kind of a leftover flow of people going to get elective surgery and things like that that might have been put off from last year. So hopefully you negotiated that aspect well, and if your renewal is coming up, make sure you understand that. I hope that made sense.
Is there a correlation between returns in the stock market and our premiums that are charged to customers of insurance companies?
So, you know, it's funny I don't know who asked that question, but that's kind of funny. If you look at, you know, everybody was in the health insurance industry was so afraid of Obamacare. But if you look at premiums going like this, and you look at Aetna, United Healthcare's and the Humana stock price, and it looks like this. So I would say there's a strong correlation that when you add, you know, anytime premiums are just a pass-through function. And anytime you add legislation that increase costs, or you come out with these new medications, the actuaries are just going to risk adjust for it and pass it along by way of premium. And that's why it's so important to get to the true net cost. You know, when it makes sense, I'm a big proponent of self-funding. It's not for everybody, but did that answer?
Yes, that's fine. Next question was around are there any best practices and communication with employees about using medical care, being a consumer? Like, I think that the idea is like we spend a lot of time shopping before we buy a TV or a car, but we don't bring that same consumerism mindset to healthcare. Have you seen any companies do it really well, or have a couple of tips for us?
Yeah, there's it's really interesting. And again, the answer is yes. And if you're fully insured, you pretty much have to look to the carrier. I think Blue Cross South Carolina has My Health Toolkit, and United Healthcare has My UHC. So there's actually tools on there. So the better the employer understands them, the better they can teach the employees. Your advisor should have access to those and be able to help train up the staff. The other aspect, if you're self-funded, there's all kinds of tools, sometimes through the TPA. Healthcare Blue Book is a great tool. And then there's actually, you know, I actually just had a conversation with a health plan, a new insurance carrier. They were part of the top 15 digital startups from last year. They're very well funded. They actually are the insurer for United Healthcare. And they have price controls built in. Again, it's not for everybody because it's a very heavy tech function. You have to go look up the procedure on their website, but they make it really simple to do so. And the employee saves a ton of money. Employer saves significantly.
2 last questions, and I'm just going to read them because I don't even know what these 2 mean. Vince, do you have any projections on the fate of qualified small employer health reimbursement arrangements, QSEHRA, and/or individual coverage health reimbursement arrangements, ICHRA, availability? Know anything about that?
So I mainly stay upmarket, but we've actually had some switch. The individual coverage HRA, we're seeing more of. They call them ICRAs. And basically, it's kind of like a defined contribution model, if you remember those, where hey, we're going to do away with our health plan as we know it today, but we're actually going to offer you X amount of dollars so that you can go out to the exchange or get your plan on the exchange, and then we'll reimburse you the premium up to a certain threshold. So there is a place for those, but it's in that under 50 space, and it's kind of a one-off. I think we've seen that more in the hospitality industries where you have higher turnover and less plan participation.
Okay. Last question, and then I'm just going to hold the rest. There's a long list for after Warren's portion, but last question for you is, as more companies go to self-funding and looking at the individual medications being taken, what can a company do to protect itself from being accused of crossing the HIPAA line?
That's a great question. The important thing is to know your PBM and how they charge. We have a tremendous pharmacy audit team that works with the PBMs and not only can reprice last 2 years of claims, but can actually project a new 5 new PBMs what they would have charged, so you can see your savings, but then hold them accountable going forward. Again, your advisor should play a big part of that, helping you find the right partner. So with the HIPAA privacy laws, very understandable, that's kind of a slippery slope where there are people internally in a self-funded plan who are they're the HIPAA privacy officers, and they're going to see some claims information, but you do have to protect that and guard it, and you can't make decisions based off of it. That's the main thing.
Awesome. I'm going to hold the rest of the questions. I'm going to mute you, Vince and Warren. Looking forward to your portion of the presentation, sir. And I think Vince is going to advance your slides.
Yes, sir. Can you hear me, Robert? Great. Okay, so when we started preparing for this about a month ago, I actually reached out to 6 or 7 of you guys that are members that are friends of mine, and I asked, what would you want to hear about? And this is really what you kind of told me back in your emails. You told me that you've been laser focused on this COVID management stuff for the last 9 months. And so therefore you've lost focus on some things that may or may not be important. And the 3 questions that were asked really are: what risks are new that we should know about right now? What risks are continuing to develop that we need to be getting ready for? And then what risks have we maybe forgotten about because we've been so distracted by COVID management? So with that as kind of a backdrop, as a framework for our discussion, we're going to talk about some of the things that relate to these things. Next slide, Vince. So the way I've kind of bucketed these things in my brain is fun facts, random observations, and then some notable client events that I saw from 2020. This is, I guess, falls into kind of the fun fact category. And I'm still not 100% sure if my conclusion is accurate. Does traffic gridlock save lives? But one of the facts is that many states are reporting speeding tickets being issued in excess of 100 miles an hour, twice as many as normal, which is crazy. Miles driven, we all know, are down last year. So nationally, the miles driven are down 17%. However, the fatality rate per mile is up 31%, and occupant ejection rates are up significantly. So I guess the conclusion is people are driving fast and not wearing seatbelts and dying in these accidents. And I guess the takeaway here might be: what questions are you, or what are you doing with your fleet safety program differently this year than last year? If nothing else, we should be having the conversation with our people driving company vehicles that traffic patterns have changed. Rush hour is different, if there is such a thing, in your area. And then, understanding that the other guy might be flying around going 100 miles an hour in his Dukes of Hazzard car there, the General Lee. So be on the lookout for the other guy, but also notice that traffic patterns may have changed and may continue to change as we evolve and hopefully get back to normal. Another thing that I'm continuing to hear about from my clients is supply chain issues continuing to nag and concern them. This time last year, we were hearing reports of this virus in China, and China was going into this lockdown mode. And a lot of my clients were very afraid that they were going to be affected by product or component parts, things they were sourcing from China. And then the next thing you know, the virus is here and we're in the lockdown mode. A lot of manufacturing companies were really shut down for a couple of months here. Now some of these companies are going a million miles an hour trying to catch up for the 2 months of production or reduced production that they had. And they're being pressed to produce. And in the wake of this, in the face of this increase in demand, they're having to deal with COVID absences and people being out of the workplace because they've got COVID, having to be quarantined, et cetera, et cetera. So, we had shortages of things like toilet paper, paper towels, staples like that back in even some food staples back in the early days. And now the shift is now moved into products like ammunition. Tell me where I can find some 20-gauge shotgun shells, please. Every time I go to Cabela's, they're sold out. So there's weird things going on with supply chains. A client of mine about a month ago called me and said, Warren, we've got a big problem. Our sole supplier of raw material had a catastrophic failure to their production line. So, okay, tell me about that. And they said, well, that's our supplier has been running 24 hours a day for the last 9 months trying to keep up with demand, and they failed to take down their equipment for maintenance. And so they literally ran their machinery into the ground. And we're going to be out of product in a month. I said, well, how much inventory do you have? We've got a month's worth of inventory, and that's about the time they're telling us they're going to be back up and running. So we talked about insurance coverages. They've got the right coverage there, but I guess the takeaway there is, what questions are you asking your suppliers about their resilience? Do we need to be asking questions at a deeper level? Don't be afraid to ask them tough questions. And then, how resilient is your business? What questions do you need to be asking internally to your operations people, your production people, about some of these resilience issues? And how do you know that? Have you tested that? Have you ran various scenarios? So just something to think about there. Another thing that kind of scares me related to some of these production issues is I've heard stories about finance and HR people getting out of the office and working in the factory or working in shipping and receiving because there's been some COVID absences. Now, Robert probably runs a mean 10 key, but I don't know if I want him out there working in the shipping and receiving area. He might ship something to the wrong person, and nor would you want that person in there, doing month end for you. So just be aware of that. If you get called in to do something like that, be sure you've got the proper protective equipment on and that your people are trained to do what they're supposed to be doing there. We all want to help out in a pinch, but just be sure we're being safe about that. So cyber events definitely have increased in 2020, and a lot of clients are asking me these questions. And I pulled some data here that was interesting to me. The biggest issue that's affecting my clients has been cyber ransom. And cyber ransom is essentially where you walk in the office today, nothing works. You can't bill, you can't produce, you can't ship because someone has taken control of your systems, and everything today runs through the computer systems. And so they ask you for a ransom. And the average ransom demand was $115,000 in Q1. The bad guys, being opportunistic souls, have gotten active, and now their ransom demands are up to around $250,000. I actually had 3 clients of mine that faced a ransom event in like September-ish, October-ish. And believe it or not, pivoting a little bit from that, I've had 2 clients in the last 90 days that have been duped by these cyber guys sending emails asking them to wire money to other places they shouldn't. And I thought we had gotten past all that, but you've got busy CFOs, busy controllers. The criminals are getting craftier in how they are requesting this, and it's sad because the finance person that sent that money to the wrong person is embarrassed. And I guess the takeaway here is, are your internal controls bulletproof in that area? And how do you know that? These people thought they had bulletproof controls, but they just didn't do what they should have done. And then the ransom event, is your team ready for that? How do you know that? When I talk about these issues with clients, the first statement they make is, "Oh, I've got a great IT guy." Well, that's great. I appreciate that. But just be sure you tested it and you know how you're going to respond. So initially, I was getting a lot of phone calls early in this COVID about, what if somebody sues me because they caught COVID at my place of business? What if one of my employees catches COVID? Are they going to sue me? Fortunately, so far, that negligence litigation has really been very, very small, with the exception of certain industries like cruise lines and things like that, where people have sued the cruise lines for catching COVID on the boat. It's really, really hard to prove where you caught it. If you're on a cruise for a week and you caught it on the cruise line, that's pretty simple to show that. But if someone were to walk into your place of business and then call you a week later and claim they caught COVID there, that's tough to prove. So far, none of those, not many of those lawsuits have gotten traction. A lot of insurance companies have virus exclusions. If they didn't already have it on there, they're putting it on these policies now to avoid those kind of claims. Glenn McConnell has been really, really trying to put tort immunity in some of these COVID relief bills. So far, he has not been able to. Maybe it's not necessary. I don't know, but it's not in there yet, but maybe there's tort relief coming. And then we've all heard about litigation versus insurance companies for business interruption claims. Most of these are coming from businesses that were affected by government shutdowns, restaurants, things like that. And those, so far, those have gotten very little traction as well. So it's been a lot of smoke, but not a lot of fire yet in the litigation area, but it's something that our clients continue to ask about, and we continue to watch as these things develop. So I've kind of bucketed a few things in what I call COVID hangover risks and costs. Early in COVID, a lot of clients were calling me about, do we need to test our employees? That quickly kind of became a topic that was not a topic. But I do have a client of mine that called me 2 weeks ago. And during the conversation, we were talking about things. And they said, yeah, we're going to start testing our employees next week. I said, well, tell me about that. And so what they told me is that they're going to sample 10% randomly of their population every week and test that population. And I said, why are you doing this? You haven't had any COVID outbreak problems. And he says, you're right. We haven't, but we don't want any. And right now, our business is so good. We are running at a record pace, and we just can't afford to have people out for COVID. So this is sort of a risk management layer they've added to their processes to try to avoid a breakout. Vaccinations at some point are going to be available to most of us. And, do you make that a mandatory thing for your employees? That's just another question to be asking. That's really an HR question, but could have some cost implications there. I hear there's an OSHA standard that's going to be coming down from the new administration about, COVID safety, how to make your workplace COVID safe. So that'll be interesting to see how that develops. And the next two are really sort of next level thought processes. The workers' comp medical providers, there are already a limited number of medical providers that want to treat workers' comp. So when you go down the path of workers' comp, it takes a while, and employees tend to get frustrated. And when they get frustrated, that's when they get in to a litigation mode, and they bring an attorney into the equation. Well, now that we've got additional layers of stress on the medical system, it's taking even longer to get through the workers' comp treatment and rehabilitation of that employee. So, you may want to just talk with your HR people and your safety people, the people that are involved in the claim process, and just have them explain to your injured worker, what's going on. Be patient. We're going to take care of you. The insurance company is not the one jerking you around. This could be a function of the medical provider network and the systems and that pathway. And it's not an insurance company that's trying to, try to pull one over on you. So be aware of that. I want to attached to what Vince was saying earlier about delayed procedures, elective medical procedures in 2020, where, you know, Warren may not have had his hip replacement, or Vince may not have had his rotator cuff fixed because of this this backlog in the medical providers. You know, as that frees up, the people that didn't have it last year are going to have these this year. And that could affect finance, that could affect production, that could even affect your sales force, where all of a sudden now you've got twice as many people that are quote out of work because they are rehabilitating for these events. And that could create a productivity drain on you. I mean, just imagine if you've got 4 salespeople and 2 of them are now off the road because they can't travel, and all of a sudden the world reopens. Your salespeople aren't out seeing customers, and everybody else's salespeople are out beating down the doors and stealing your business. So a couple of ways to look at that, but I just want you guys to kind of think about that, be aware of that, and try to plan that as best you can.
Hey, Warren, I just want to give you
Yes, sir.
about a 5-minute time, and so we have a few minutes for questions before we close at 9.
Yeah, we got 3 slides, and I think we can get through those pretty quickly. Work from home. I think we all know that we're not all coming back to the office. A lot of risks here. I mean, this picture is a perfect example of it. I don't think she's ergonomically correct. You know, so do your people have the correct office equipment, chairs, desks, et cetera, at home? And then there's just lots of other risks with working at home, with depression, alcohol, and drug abuse. Just lots of things there that are different risks that we didn't have before that are going to continue to be there. Next slide, Vince. Vacancy and underutilization issues. You might have a portion of your facility or a location that is not being used the same way it was before. It may be completely empty, or it may be partially empty. Your opinion of that facility may be different than your insurer. Your insurer may think that's a vacant building now because it's not being used the way it was before, and that can have insurance implications. You know, I got a client of mine that called me last week and said, hey, we've got this 70,000 square foot space we're not using. We want to lease it out to this company. Oh, well, who is it? Well, it's this company here. What are they storing in it? Lithium-ion batteries. That's a problem. So we had to talk through that, and ultimately they had to turn that tenant away because lithium-ion batteries, if they're charged, are a huge fire hazard. And, you know, he didn't realize that, and the last thing he wanted was to have, you know, a 70,000 square foot tenant space burn down his whole factory. So just be aware of some of these changes in your property. And then the last slide is things that we don't need to forget about. And these are projects that we typically engage with our clients, you know, in a normal year, and we're trying to get our clients refocused and think about these things. From a tactical standpoint, you know, fleet safety, distracted driving is always going to be an issue. Workplace violence, active shooter, maybe that's the silver lining here. Nobody's been at work, so there hasn't been any active shooters. So maybe that's the silver lining here, but that's going to be an issue going forward, I'm sure. The basics of safety and compliance training, the basic blocking and tackling, let's not forget about that. And then we do live in South Carolina. You know, the last really, really major event we had was Hugo in 1989. So, you know, just be aware of that as we get into hurricane season this summer, what your plans are for that. And then some of the things we are reminding clients about as long-term issues, and these are kind of things that are important, but might not be urgent, but you do not want them to become urgent and important. So planning ahead, succession planning, liquidity planning for ownership. Again, these things can also have insurance solutions to these. Changes in the corporate tax structure, yeah, that's probably going to happen, I would bet. And so as these things change and tax structures change, that brings in other options like captives. It could be a way to play on these tax issues. So I'm going to wrap it up there. I got a couple of informational slides after this, so I think that's probably a good place to stop, Robert.
That was awesome and fantastic job. I've got like 4 calls to action I've just written down. So thank you for bringing that great content. And I've got some questions. I'm going to hit you up rapid fire, but I'm not going to get to them all. So for everybody on the call, I'm going to share Warren and Vince's contact information for any follow-up questions, or if you just want to have a quiet conversation to bounce off what you currently got with your current broker with another set of eyes, Warren and Vince would be perfect for that. Warren, a couple questions. Going back, you mentioned you had some recent hands-on experience with a ransomware situation. Would you walk us through the cliff notes of what that is? I hear about it, but I've never been through that.
Yeah. What's interesting is I had two of these things happen within 2 weeks of each other. And I'm not making this an insurance pitch because it's not, but it's just the outcomes were very different. One client had cyber insurance and one did not. And the outcome was not so much financial, but it was with the path towards resolution. And that the one client that didn't have insurance, of course, we're not paying this ransom. It's a principal thing, and these bad guys aren't going to stick it to me. And they spent a few days trying to figure some things out. The bad guys got tired of waiting, and the bad guys sent some type of signal to the computer system and literally destroyed their servers. And so not only were they out of business for a couple of weeks because of they had $100,000 worth of server damage, but now they're out of business, for a couple of weeks trying to put all the pieces back together. The other client called me on a Friday afternoon and said, "Hey, Warren, we've had this problem. Our IT guy's been trying to resolve this. I think we need to get you involved." So we then connected him to the insurance company. The insurance company put him in touch with 3 different people. One of them was a hostage negotiator, essentially, a company that negotiated with the bad guys. And the client called me and said, "Warren, this is the craziest thing. We just talked to these guys." And they said, "Yeah, we know these perpetrators. This is like the 25th time we've dealt with them in the last month. We know how they operate. We know exactly how to shake down this ransom from here to here. We're going to probably end up at this point." And so that's one part that was involved. The second part was this forensic group that came in to figure out what happened and how do we close the back door on this. And of course, the third player was the actually insurance adjuster, who was an attorney in this type of area, who was really able to help our client understand, did they have any type of liability here? Was any data exfiltrated that they might have a problem with? Long story short there, they negotiated the ransom down, and by Saturday afternoon, I'm getting a phone call from the client saying, how do we get the money to these guys? And fortunately, the insurance company has a Bitcoin wallet. They were able to facilitate the Bitcoin transfer, and the client was back up and running on Monday. So they really didn't experience the same frustrations that the other client had. They didn't have to call their customers and tell them, we're having problems shipping you product. They didn't have to explain to their employees what was going on. It really was a 48-hour experience. And the key takeaway there is that if you're going to buy insurance, be sure you understand what the backside of that transaction looks like, because not every cyber insurance product has the correct claim handling component to it. And I'm not going to mention any names, but there's a lot of brand name insurance companies that are selling cyber insurance that really don't understand the claim process. And that's really what you're buying here, in my mind, is how do you get you back in business?
Well, that was awesome, and that's all the time we have. So I'm going to close on that. Really appreciate Vince and Warren. You guys have been awesome partners of the CFO Council, and that was great content. I feel smarter, and I'm more nervous. I'm a little edgy with all this risk management that we're responsible for. So thanks for bringing us information and maybe some actionable items, new information, and then a little healthy set of nervousness as we start our day. So great job. And what I'm going to do is I'm going to send out a copy of this presentation. I'm going to send out a contact information for Vince. I am also, this is the most important thing, I'm going to send a link to my LinkedIn post where I say, great job. And you need to like, comment, and reshare my post. And you could be a winner, like Joe Moore is the Spread the Word winner. And you could get awesome LCE swag, CFO swag, like coffee cups, maybe even a jacket, hats. Yes, I went crazy. and trying to give this stuff away and get it out of my house. So we're right at 9 o'clock. Everyone have an awesome day. And thank you, Vince, and thank you, Warren. Bye, everyone.